Hi, this is Dr. Nick. I'm here at the Digital Health Summit at CES 2020. I'm delighted to welcome an old friend and colleague, Alfred, who describes himself as the health tech futurist. Alfred, thanks for joining me.
My pleasure.
So we were talking a little bit before. You feel like we've missed an inflection point. What is that?
It's a tipping point where things have now changed to the point that we're not going to go back, is basically it. And I think what's happened is telehealth has snuck up on us and is making an enormous difference in how healthcare is being done. And I believe it's going to be one of the most important features for making healthcare more efficient, more affordable, more effective.
I can't disagree, because I got two family members, my two daughters, who both accessed it. I had to sort of, I don't want to say push, but give them, try the app. They tried it, and they're both now don't want to go and see a physician. They found it so convenient. So I agree. Why has it taken so long?
Well, there's a lot of reasons. One of the big reasons is in the US, medical practice is licensed by the state level, not the federal level.
Sorry,
Yeah.
hopefully nobody heard me laugh there.
Yeah.
Yes, go on. I know.
And so this creates problems. With telehealth, because you can't have a physician in Pennsylvania treat a patient in New Jersey. So one of the things that really helped break the dam on this was the VA, the Veterans Administration, and they've done landmark work, primarily with mental health, for helping people with psychological issues, making it easier for them to access treatment. But they've gone beyond that, and they've really sort of set the bar high. And because they're the federal government, it's been a little easier for them to make inroads. But now we have private companies that are doing it. There is more than one company out there that has telehealth coverage with licensed physicians in all 50 states available, so you don't have to pick one that's just local to you.
Yeah, I even know one physician who's licensed in all 50 states, which is quite an extraordinary feat.
That's quite a feat.
Astounding. So as we think into the future of this, so I think we both agree, but what's next for telehealth? Do you think VR and some of this augmentation is going to make a difference in this space?
I'm not sure about VR, except as a treatment.
Interesting.
VR as treatment is very exciting. There's a lot of very interesting stuff being done, both for psychological issues, but for others as well. There's a company that's developed a program for patients with hot flashes after chemo. And VR can help them deal with that. No, I think initially what's going to happen is it's going to be that remote monitoring, so that the physician, the healthcare professional, can get the data that they need. I mean, a video chat is really no more effective than a phone call. I feel sick. Well, where does it hurt? It doesn't really tell the doctor anything, and pretty much they have to cover themselves and say, "Come on in, and we'll take a look."
Right.
But if you've got if you've got ECG data for the past few days, if they're diabetic and you have their history of glucose levels, if you've got temperature over time rather than just what's the temperature now, that richer data set is helping already to help healthcare professionals make choices without having to have the patient come in. And one of the things that's amazing me is the fact that this has now enabled the old-fashioned house call. Doctors are actually going to the home.
I grew up in that world. Yeah,
and
exactly.
So did I.
Yeah.
But the amazing thing is because 90% of the complaints don't need a clinical visit. Home treatment or let's wait and see or whatever. And so if you can take those 90% of the patients out of the waiting room, not have to spend all that time traveling, all of a sudden the practice becomes more efficient. The health staff is able to batch the work and do it more efficiently, and it's freeing up the professionals to actually go to where the people are sick and not bring sick people into an office with other sick people.
Fantastic, exciting times. I think this hall is filled with opportunities for that additional monitoring. Telehealth has absolutely reached that inflection point. Alfred, thanks for joining me today.
Thank you so much. I appreciate it.
This is Dr. Nick. I'm here at CES 2020 at the Digital Health Summit.